Thank you very much. It's an honor for me to speak today about our experiences with Philips SmartSpeed at the University Hospital in Bonn. So why Philips SmartSpeed is so important? Today's healthcare environment is shifting rapidly, driven by demographic change and economic pressures on the system. We as radiologists are faced with an aging and increasingly multimorbid patient population. So acquisition times need to be short enough that diagnostic scans can be acquired, even for patients that cannot lie in the scanner for a long amount of time due to pain or a low breath-hold capacity. Economic pressure on the system is high. Imaging plays an increasingly pivotal role in clinical therapeutic decision-making. So we are confronted with an ever-growing number of patients. The rate of non-diagnostic scans due to artifacts should be reduced as far as possible. Also, acquisition times should be faster while maintaining image quality. Philips SmartSpeed addresses exactly these points for us. It allows, as we've already heard, compresents beyond the Cartesian sampling scheme, and it uses a deep learning-based AI for better images, and we can apply it to 2D and 3D sampling, Cartesian sampling schemes of all contrasts. I want to start with Philips SmartSpeed within the prostate. The prostate protocol is a very standardized protocol. The conventional protocol at our hospital consists of high-resolution T2-weighted images acquired in a sagittal, axial, and coronal direction. We then acquire 3 diffusion-weighted images with p-values of 100, 400, and 800 to calculate the ADC map. We acquire a high b-value diffusion-weighted image with a b-value of 1,500, and then the contrast-enhanced T1-weighted images. The conventional protocol usually takes about 24 minutes. With SmartSpeed, we are able to reduce this to 17 minutes by 7 minutes. So while we are able to acquire or examine 3 patients with the conventional protocol, we can examine 4 patients with the Philips SmartSpeed protocol. My colleague Leon Bishop systematically analyzed Philips SmartSpeed T2-weighted images within the prostate, and they found that the Philips SmartSpeed images have a better image sharpness, a higher apparent signal-to-noise ratio and contrast-to-noise ratio, significantly reduced artifacts, and as already seen, reduced the acquisition time by 24 to 26%. I want to show you 2 clinical examples. On the left, we see the conventional sequence, and on the right, we see the Philips SmartSpeed sequence. Particularly for patients that cannot receive buscopan and have some contraindications, the bowel will move, and it will often cause such motion artifacts that, as in this case, often also run through the prostate. Seen here. With Philips SmartSpeed, we are able to reduce these artifacts and acquire artifact-free images with a higher signal-to-noise ratio, apparent signal-to-noise ratio, and contrast-to-noise ratio. This is the same patient as we've seen before. This patient has a Pirates 5 lesion within the left peripheral zone. On the left, again, we see the conventional sequences, and on the right, we see the Philips SmartSpeed sequences. We note the significant time reduction from 3 minutes 52 seconds to 2 minutes 43 seconds. And what we note is this lesion here in the peripheral zone on the left has a long contact to the capsule, and we suspect infiltration of the neurovascular bundle. But because the conventional images usually are a little bit blurry and are not as sharp, with the Philips SmartSpeed image, we are able to say that the neurovascular bundle is actually infiltrated with a higher diagnostic confidence. Same goes for the high b-value diffusion images. We achieve a significant time reduction because we are able to acquire less averages, from 18 averages to 10 averages, from an acquisition time of 3 minutes 32 seconds to 2 minutes. And here we see the 3 B values, 100, 400, and 800. In the top row, the conventional sequences. In the bottom row, the Philips SmartSpeed sequences. And again, we can reduce the averages we take per B value from B400 from 4 to 2 averages, and at a B value of 800 from 8 averages to 4 averages, and thus reducing the acquisition time from 3 minutes 35 seconds to 2 minutes and 5 seconds. This is just to show you that the calculated ADC map actually looks nearly the same. We do not lose any information. The lesion is clearly to be delineated here in the left peripheral zone, and we suspect the invasion of the neurovascular bundle. While we are very sensitive for lesions within the peripheral zone, we often miss lesions within the transitional zone. And I believe that Philips SmartSpeed actually has a big impact here. Here we see a patient with a Pirates 5 lesion here in the left transitional zone. Philips SmartSpeed will have a big impact in this area because these lesions are sharper and the lesion delineation is higher, while acquired in a shorter amount of time. Next, I want to talk a little bit about SmartSpeed imaging within the liver and pancreas. I'm often asked as a radiologist whether I'm afraid that by applying AI to reconstruction, for example, whether we lose information. And I can assure you that I've never experienced this. This is the perfect patient. He has a lot of biliary hamartomas with a lot of fine lesions here within the liver. On the left, we see the conventional sequence with an acquisition time of 3 minutes and 18 seconds. On the right, we see the Philips SmartSpeed sequence with an acquisition time of 2 minutes and 24 seconds. And I want you to pay special attention to this area here. We see those lesions, and every lesion can also be delineated in the Philips SmartSpeed sequence, but actually sharper. Particularly, for example, this lesion is better to be delineated in the Philips SmartSpeed image. So I'm not afraid that we lose any information. This is a patient with a Cavernous transformation of the portal vein. Those tortuous veins are often very blurry in the conventional sequence. Within the Philips SmartSpeed sequence, they are much sharper, and we can follow all those fine structures here in the center. And we reduce the acquisition time from 3 minutes, 18 seconds to 2 minutes and 24 seconds. This is a patient with a hepatocellular carcinoma after treatment with transarterial chemoembolisation therapy here in this segment. And this is a patient that cannot hold his breath for a long amount of time. So we observe those motion artifacts, breathing artifacts, running right through a lesion that's right here subcapsular. And by the use of Philips SmartSpeed, those artifact lines are gone. We can clearly delineate this lesion. I mean, we can also delineate it here in the conventional sequence, but imagine a smaller lesion. You might actually miss it when such an artifact line runs through it. Same goes for the diffusion-weighted image. We have a much better signal-to-noise ratio within this Philips SmartSpeed image, particularly here in the right lobe. We lose a lot of information here in the conventional image. And those artifact lines are significantly reduced in the Philips SmartSpeed image. And now, very important, we remember this lesion here subcapsular. We cannot delineate it in the conventional sequence, but we can actually clearly see it in the Philips SmartSpeed image. This is a patient with a solid pseudopapillary tumor of the pancreas. We have the conventional sequences on top and the Philips SmartSpeed sequences at the bottom. We see this lesion, and image sharpness is again increased from the conventional to the Philips SmartSpeed images. And for the diffusion-weighted images, we can say that the acquisition time is reduced while image quality is the same. And the ADC value, maybe we can even delineate it a little bit better here. Next, I want to talk a little bit about Philips SmartSpeed and musculoskeletal imaging. These are patients that are usually in a lot of pain, so they tend to move a lot and they cannot lie in the scanner for a long amount of time. Shown are the conventional sequences with the Cartesian sampling scheme in the top row and the Philips SmartSpeed sequences with the multivane acquisition and propeller acquisition at the bottom. And what we see is a significant reduction of motion artifacts. Particularly, such tears can be much better be delineated here in the Philips SmartSpeed sequences. And what we also see is an acquisition time reduction from 2 minutes 52 seconds to 2 minutes and 18 seconds. You can also apply Philips SmartSpeed within the brain. Shown is a very young patient with an Ewing sarcoma. On the left, you see the conventional sequence, on the right, the Philips SmartSpeed images. What we often observe in the conventional sequences is this physiological noise, those kind of motion artifacts within the area of the basal ganglia. It's very blurry. For the Philips SmartSpeed sequences, these artifacts are significantly reduced. The basal ganglia are much better to be delineated. Also, we have an increased image sharpness and an overall better image impression. The acquisition time is reduced from 4 minutes 1 second to 3 minutes and 19 seconds. I'm not an expert in cardiac imaging, but nevertheless, I really wanted to show you these images because I find them very impressive. It's fetal cardiac MRI with Philips SmartSpeed. This is a fetus with a hypoplastic left heart syndrome with dysbalanced AV canal within the uterus of the mother. This is the conventional sequence with an acquisition time of 12 seconds. With the Philips SmartSpeed sequence, we are able to reduce this acquisition time from 12 seconds to 9 seconds and increase image quality. If you then apply the AI denoising, you have beautiful images without nearly any noise, and you don't lose any information. I want you to pay special attention to those muscles. You can very well delineate them here in the denoised image. It's much better here in the AI denoise and Philips SmartSpeed image. So this is kind of an outlook into the future. With this, I want to thank you and conclude that Philips SmartSpeed reduces acquisition time, reduces artifacts, and enables similar or higher image quality. Thank you very much.